Let's talk about something that can be a huge source of stress for families, but is actually way more common than you might think. We're diving into encopresis, or what's often called fecal soiling in children. You know, it's one of those things that's so misunderstood, and that can lead to a lot of frustration for everyone involved. So our goal here is to clear up the confusion and shed some light on this condition.
To get started, let's look at a real-world case study. We have a 5-year-old girl who's having soiling accidents. And right away, we see a few key things pop up. A history of constipation, a big life change, her parents separating, and the fact that her toilet training started a bit later. This really shows us from the get-go that encopresis is rarely a simple one-cause issue.
So what exactly are we talking about? Well, the medical term is functional encopresis, and it's defined as the repeated passage of poop in inappropriate places, like in their underwear, by a child who's at least 4 years old, developmentally speaking. That word functional is super important. It basically means there's no underlying disease or physical abnormality causing it. This is a recognized medical condition, not just bad behavior.
Now, this is where it can get a little confusing and honestly pretty counterintuitive. You'd think the problem starts with the soiling, right? But for the most common type of encopresis, the problem actually starts with, well, with holding it in. Let's break down this surprisingly logical, yet very problematic cycle.
Okay, so here's the chain reaction. It often kicks off when a child has a painful bowel movement. Maybe they were constipated. To avoid that pain again, they start with holding their stool. But that held-in stool just gets harder and bigger in the colon, eventually creating a blockage, or what doctors call an impaction. While new, liquidy stool still has to go somewhere, so it ends up seeping around that hard mass and leaking out. And that is what causes the soiling accidents.
And this is the most crucial takeaway for any parent or caregiver. The child is not doing this on purpose. It is not an act of defiance. Their body has literally lost the sensation of needing to go, and that leakage is completely involuntary. This is why getting angry or punishing them is not only useless, it can actually make things much, much worse. Understanding this changes the whole game from a battle of wills to a medical issue that needs compassion.
It's also really helpful to know that there are two main types. With continuous encopresis, the child has just never really gotten the hang of being fully toilet trained. But with discontinuous encopresis, a child was trained, and then they start having accidents again, and this is often tied to some kind of stressful event. Just like the parental separation we saw in that first case study.
So if this is something your family is dealing with, what can you expect when you go to the doctor? The good news is there's a very methodical way clinicians figure this out. It's a structured approach to get to the bottom of the problem and find the right diagnosis.
You know, being ready for that doctor's visit can make a world of difference. The diagnosis really leans heavily on getting a super thorough history, so the more details you can give as a parent, the clearer the picture becomes. So what kind of things are they going to ask? Well, the doctor's going to want to build a really clear timeline of your child's bowel habits. They'll ask when toilet training started, how often your child typically poops, and about any history of hard or painful stools. They might even ask for a description of the poop itself, because that can give some really vital clues about what's going on inside. Next up is the physical exam. The doctor will check your child's overall growth, do a basic neurologic checkup, and gently feel their tummy to check for any signs of impacted stool. Sometimes a quick rectal exam is needed to check the muscle tone and see if there's stool right there in the rectum. This all helps to rule out any other causes and confirm what's really going on.
All right, so once there's a clear diagnosis, the focus pivots completely to management. And this is the hopeful part. There is absolutely a path forward. This is not something families just have to live with. There are real, effective, and actionable solutions. And what's great is that the treatment is tailored directly to the specific cause. For that really common retentive type, the main goal is softening the stool and retraining the bowel. If it's more of a toilet phobia, a gentle, reward-based approach works best. And for cases tied to stress, like discontinuous encopresis, talk therapy can be a really important piece of the puzzle.
So let's zoom in on that most common scenario. The strategy is really a two-pronged attack. First, you have to medically manage the constipation, right? You got to make going to the bathroom comfortable and pain-free again. And at the same time, you have to start retraining the body and the brain to recognize and respond to those time-to-go signals. This is where that bowel retraining comes into play. A big part of it is having the child sit on the toilet for just a few minutes after every meal. Now, why after meals? Well, it takes advantage of our body's natural reflex. It's called the gastrocolic reflex, to kind of make room after you eat. Think of it as an out with the old, in with the new signal. The whole point is to create a relaxed, predictable routine, never a power struggle. So to wrap up the management plan, it really stands on these three solid pillars. First, there's medication, like stool softeners, to clear out any existing blockage and keep things moving smoothly. Second, diet, getting more fiber from roughage and plenty of liquids. And third, that crucial behavioral piece, the scheduled, totally stressful toilet sits to retrain the bowel. So we've gone through the what, the why, and the how. But the road to recovery isn't just about medicine and schedules. The real secret ingredient, the thing that turns this challenge into a success story, is patient, empathetic support. So the final question I want to leave you with is this. Now that we understand the physiology, how can we, as parents, as family, as clinicians, provide that consistent positive support that truly empowers a child to heal?